morning everyone, I am Kleir Castillo from BSN 1B, and for this return demonstration, I will be assessing the thorax and lungs. But first, I will conduct an assessment. In assessment, I'm going to identify and determine what are the possible factors that can affect and associate with the thorax or lung problems. In this procedure, I will need a stethoscope to examine the posterior thorax. Before we proceed, I'm going to perform a proper hand hygiene first by applying antiseptic alcohol. And as you can see, I'm going to examine my client in a closed room filled with curtain for her privacy. And we should always be reminded that we should only expose the certain body parts of our client that will be examined, and the rest of her body parts will be covered by a drape. Good morning, ma'am. I am Kleir Castillo, and I will be your student nurse for today. May I know your name and age?
I'm 15 years old.
Okay, ma'am. For this procedure, I'm going to assess your thorax and lungs. But before that, I'm going to ask you some few questions. Like, active po ba kayo, ma'am, sa inyong lifestyle?
Yes.
Yes. Do you have any family member na nagkaroon po ng pneumonia, lung cancer, or other lung issues?
No.
No. Do you smoke, ma'am?
No.
No. And last is, do you drink some alcohol beverage?
No.
Okay, because those are the factors that can affect your lungs. Next, ma'am, is I'm going to ask you to wear a drape so that I can assess you comfortably, most especially your posterior or your back area. You're going to wear a drape so that your front part will not be exposed, but only your back part. Is that okay, ma'am? Okay, ma'am. Now I'm going to do inspection or observation. I'm going to inspect the symmetry of your thorax from posterior, anterior, and lateral part. Now, I'm going to compare the size of your right chest to your left chest. And you have a similar size po, ma'am. And we need to compare the size kung sila po ba ay appropriate, kasi minsan we have chances na mas malaki po yung right chest sa left chest, and para maiwasan na rin po yung chest deformities such as barrel chest. And next, ma'am, makakatayo po ba kayo? Yes. Ma'am, kindly stand up so that I can inspect the alignment of your backbone. This is the backbone. Okay naman po siya. And we need to check the alignment of your backbone para malaman po natin kung meron po ba kayong S curvature that may indicate scoliosis. And okay naman po ang inyong alignment. And last po is I'm going to inspect the way you stand. And ma'am, you stand very well naman po. Hindi ho kayo hukot at hindi rin po kayo naka-bend na ganon or naka-forward bend. So that means normal po ang inyong stance, normal din po ang inyong alignment sa backbone, and normal din po yung sizes ng inyong chest. Now I'm going to perform palpation. I will palpate the posterior thorax to check the thoracic expansion. But first, I'm going to check my client's temperature by placing my hand in the skin surface. And it is warm to touch. Now, I'm going to palpate. Using my two hands, I'm going to put it in the lower back of my client. Kasi ito po yung base ng ating lungs. And dapat ito ay magkahiwalay. Now, I'm going to ask my client to inhale and exhale. Ma'am, kindly inhale and exhale. And as you can see, nag-iiba po ng direction ang aking kamay, which indicates lung expansion. Now, I'm going to palpate the ductal fremitus. I'm going to use my two hands again, put it in the lower back, but this time, I'm going to ask my client to say some word like blue moon. Ma'am, kindly say blue moon repeatedly.
Blue moon, blue moon, blue moon.
Okay, may naramdaman po akong vibration, which indicates normal po ito. And kung ano po yung nararamdaman ko dito sa right side, ay nararamdaman ko din sa left side. So, it means normal po ito. Now, I'm going to do percussion. In percussion, we have two different sounds to hear. First is the resonance, and second is the dullness. Your resonance is the percussing the hollow organ, and dullness is percussing na may laman sa loob. So, for percussing, I'm going to put my hand and place it here. Medyo idiin po natin to feel the inside. And using my middle finger in this hand, I'm going to palpate the middle finger here in 1, 2, 1, 2, and here 1, 2, 1, 2. So, same sound lang po sila, and ang narinig ko lang is dullness. And next is percussing the thorax. Ma'am, kindly bend your head forward, 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 and put your arms crossed like this so that ma-expand po ang ating posterior thorax. Now, I'm going to percuss the intercostal spaces or yung pagitan po ng ribs ng aking client. Here, using my middle finger again, percuss in the middle finger here. 1, 2, 1, 2, and on the other side, the end, 1, 2, 1, 2. So, dullness ulit po ang maririnig na sound. And for the last, I'm going to percuss the 10 different spot. The first spot you'll found here. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So, percuss it using your hand, middle finger, percuss it in the middle finger here, in 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, and 1, 2. So, same sound lang sila and puro dullness kasi may laman po ang body ng ating client. So, i-double check natin and report natin kapag may ibang sound tayo na narinig. Now, I will perform auscultation using stethoscope. And if we're going to use stethoscope, dapat po walang clothes or dapat direct sa skin para hindi po magbago yung sound. And we must also remember na kung saan tayo nag-percuss, doon din tayo mag-auscultate. Now, I'm going to ask my client to breathe normally as I auscultate the 10 spots. Ma'am, kindly breathe normally. The first spot is here. Okay, so ang narinig ko po is pure dullness. And same sound lang po sila. And wala po siyang abnormal sounds like crackles or diminished breath sounds or wheezing. So, lahat po ito ay in normal findings.
Document findings in the client record using forms or checklists supplemented by narrative notes when appropriate, and report deviation from expected or normal findings to the primary care provider.